Spinal diseases of the young pose a very specific problem, and in some ways it is a good problem to have, and that is that the patients are perfect. They come to you in excellent health, they come to you intact, and then something has happened to them. Now, usually what that something is trauma related, either an accident or a sports event that has led to a loss. And that loss is a big loss for the patient because the patient itself suddenly does not have everything that the patient had just a few minutes prior or a day or two prior. And it's a big loss to them. And thus, you must first make them understand what just occurred, bring them up to date, and then evaluate whether the loss is reversible or not. In many cases, the loss is reversible, and that is the challenge of the neurosurgeon, and it is how to correct the loss. That's the primary goal. The secondary goal, however, is one to think about the future. In young individuals, we're talking about a very long life expectancy, and I particularly think that life expectancy is going to be tremendously long as medical advances continue to occur at the current pace. And so usually when I see a 25-year-old, I don't think in terms of another 50 years, I think in terms of another 100 years of life and how I can help that patient optimize their function and their structure, their spinal structure in such a way that it will last for another 100+ years, even longer in some cases. But how do we do that? We do have the technology, and it's excellent technology right now in both addressing the initial injury as well as the long-term optimization of function and structure down the line. This is where artificial discs come into play. They're very important. It's a huge advance in terms of what we can do for patients now. This is where you have to keep in mind, and especially in very young individuals, how you can minimize the procedures so that there is a minimal cosmetic effect as well as minimal side effects to the surrounding organs as well as the spine itself. And I think we are able to do that quite well. So surgery for the young spine, I consider it really as a generative surgery. It's not regenerative because obviously the spine is already as young as it can be, but it's generative surgery that we're now restoring its structure to its status quo ante, before the injury. We do that, I think, very, very well and very effectively, and it is my hope that we're going to continue to do that on an even more minimal basis in terms of the invasiveness of the procedures as we move forward.